It seems to me that the main reason that mainstream media has not informed the public about the serious problems of hypothyroidism is that they're trying to protect the drug industry.
Hypothyroidism is tragically one of the most misdiagnosed issues we have in medicine in this country anyway today. People that are hypothyroid have a higher rate of heart attack, stroke, and cancer.
Well, and if some of those things sound familiar to you, then perhaps you suffer from hypothyroidism. And here to help us understand more is Dr. Hotze, the author of the new book, Hypothyroidism, Health and Happiness. And with him is his patient, the beautiful Carri. Good morning.
Good morning to you,
It's good to have you.
Great to be here.
It is time that we talk about this whole idea of hypothyroidism. I've got to admit, I've heard a lot about it. Some things, I'm sure are true, some are not so true. First of all, define for us, what is it?
Well, hypothyroidism is a condition where your cells don't get enough thyroid hormone. Thyroid hormones made by the thyroid gland in the neck.
Yes.
And the thyroid hormones go to every cell in the body, enable the cells to produce and use energy. It governs our body's metabolism. So if we don't get enough thyroid hormones into the cells, either from not producing enough or from other conditions that prevent it from being assimilated, then the body runs sluggish and runs slow, and you get a host of symptoms. Fatigue, inability to lose weight.
We've heard of many of these. I've heard,
insomnia, joint and muscle aches and pains, loss of romantic moods and inclinations, hair falling out, recurrent and chronic infections, mood swings, depression, irregular menstrual cycles. You can have problems with miscarriages and infertility.
And it is all coming back to this.
And it's all based on one thing: low energy production, because you don't have enough thyroid in your cells.
I want to switch now gears and talk to you, Carri, because I want to know, what symptoms were you experiencing? What was going on in your life?
Well, I was, my daughter was 8 years old, and I was, a working mom, lack of energy, brain fog. And when my daughter said, "Mom, why are you always so angry?" And I'm always generally a happy person, I said, something's wrong. My dad lived in Houston. He always talked about this man he heard on the radio.
And you thought, I'll give it a shot.
So I'll go give it a shot.
Yeah, now, did you seek help from conventional doctors?
Yes.
And what did you find?
Well, I mean, they were treating my symptoms based upon my blood work. I was on statin drugs because I had high cholesterol. But generally, I'm a fit person. Both my father has heart disease. My mother has high cholesterol as well. So they were treating the symptoms through blood work and not necessarily ever identifying that I had hypothyroidism.
Dr. Hotze, why is it that so many people, because I've actually had a friend who was misdiagnosed. This sounds like it's very common. Why is it happening so much?
Well, there's a lot of reasons. One is women have this problem 6 times as frequently as men do, because as women march through their menstrual life, they have imbalances in the female hormones, and that adversely affects the body's ability to utilize thyroid hormones. So most women at one point in their life, as they march towards the menopause, will develop all the symptoms of hypothyroidism. They'll go to their physician. The physician says the blood tests are normal, and they'll end up putting them on antidepressants, anti-anxiety medication, sleep medication, anti-inflammatory, and a whole host of medications.
And it's all for naught.
To treat the symptoms. Rather than treating the underlying problem of hypothyroidism.
I get that. When you said that, the light bulb went off in my head. I want to know how your approach is different. How did you help Carri?
Well, first thing I did was listen to her symptoms, and then I did a physical examination and looked for signs. We also checked her body's temperature, her core temperature, which was low. If you don't produce enough thyroid or enough energy, your temperature runs low. It's a classical feature. Your temperature should be 98.6. People with hypothyroidism will be in the 97s or 96. They'll have cold hands, cold feet.
That's good to know.
And so that's a simple check.
That's good to know.
And so she had these symptoms. We checked her blood, but in her blood, the blood range was, it's as wide as the Grand Canyon, as tall as the Empire State Building, and the Grand and people all fall within that range.
Wonderful.
And so what we do is we treat based upon the clinical symptoms.
Gotcha. I recommend everybody pick up this book, Hypothyroidism, Health and Happiness, and we actually have a copy of the book for every member of our studio audience, because we want you to pick it up and read it. Now, if you'd like to get more information, how and where can people with hypothyroidism get help, Dr. Hotze?
Well, they can call thyroidanswer.com, and I want to give this book complimentary to anybody who wants it. I want to educate the public, because I want people to understand understand this problem and be able to correct it naturally.